Okay, let's see the CT scan. So, a few knowledgeable points on CT scan. The CT scan is also called as the CAT scan, CAT, which stands for computerized axial tomography. This uses X-ray radiation, which is a highly ionizing radiation. If you see the CT scan machine in the CT scan room, there is a big round circle in which there is a table. That big circle is called as gantry. Now, this gantry houses the X-ray tube, X-ray detectors, optical slip ring technology. So this is called as the gantry, which has the X-ray tubes, and the ionizing radiations are coming from here. When CT scan started, it started with one detector, and now the machine has more than 7,000 detectors. So the quality of CT scan has improved a lot. Now, what is the principle behind this? How do we take the picture of CT scan, and what is the principle of working of the machine? So when the photons strike the body or tissue, they are absorbed and some of them carry on forward. Whatever the remaining photons strike the detector detects the amount of energy in the photons and converts it into the electrical energy, which is converted from analog to digital signals, and then give it to the computer system to develop a image. So फोटोन आया, कुछ एब्जॉर्ब हो गया, कुछ आगे निकल गया. जो आगे निकला वो डिटेक्टर को टकराएगा. डिटेक्टर उसकी अमाउंट ऑफ एनर्जी डिटरमिन करेगा और अकॉर्डिंगली उसकी इमेज बनाएगा. The CT room should have the lead sheets in the wall to protect the radiations from leaving out of the room. The console room or the class also has the lead protection. The CT is a linear attenuation of the X-rays. With respect to X-ray absorption, the capacity of the tissue is also called as the density of the tissue. So how much it absorbs, how much the tissue absorbs the X-ray depends upon the capacity of the tissue. And that determines the attenuation of the X-rays. This is also called as LSC of the tissue, that is linear attenuation coefficient. Higher the density, more is the absorption, which means more photoelectric phenomena. Every tissue has its own LSC value, given as number of the tissues, which is called as HU or the Hounsfield number, the CT number of the tissue. So HU number, Hounsfield number, CT number. Now why this is important? Because this has to be fed in the machine. There are set numbers for the set tissues, which usually the technicians know it, and before doing the CT they put that numbers in the machine and feed that numbers. So HU number ranges from -1000 +1000. In middle is 10 to 20, which is isodense. For isodense, anything higher is hyperdense, and less than 10 to 20 is hypodense. Now the generation 1 CT scan, also called as the EMI scan, it is an electromusical instrument, which is one patient, one detector. That was quite old concept in the old concept machines. So what does the word tomography means? The tomography, it means the tube moves and takes the scan in all angles. Now what is generation 2 CT scan? Generation 2 is conventional CT scan. It uses 30 detectors. What is generation 3 CT scan? It's also called as helical CT. Generation 3 is helical CT or spiral CT. It has 700 to 1000 detectors. The fan-shaped X-ray beam was used, and optical slip ring technology is used in there. Now, what is optical slip ring technology? it actually uses optical fibers to transmit the data and eliminate the use of cables from the detectors to the computer. A completing the CT scan very fast, that is in 1 to 2 minutes. What is single slice CT? What is multi-slice CT? So multi-slice CT is multiple section in single time, and single slice is single slice in one time. The CT angiography can be done by multi-slice. The cardiac CT, the coronary angioscoring system, all are done by multi-slice CT. Now what is 3D CT scan of bone, virtual colonoscopy, CT perfusion, CT enteroclysis? These are all the applications of the CT scan. Now, virtual colonoscopy is an emerging tool to evaluate the bowel cancers. Generation 4 CT is also called as MDCT, which is multi-row detector CT. These are the multi-slice CT, which has the 64 slice in 1 second. There are no beam hardening artifacts in this. Now the machines are coming with 256 and above slices. Now what is EBCT? It is electron beam CT scan, which is a millisecond CT. Also called as the real-time CT scan. It's ultra-fast CT scan. It's used in cardiac imaging, and as complete scanning is done is 0.8 seconds. Using a spiral CT scan is a standard now. Helical or multi-slice CT scan that's also called that. Now what is HRCT scan? It's the name of the software which is used with the helical spiral CT. The bone algorithms. So the bone algorithm is the basic principle of HRCT software. Commonly used in interstitial diffuse lung disease but it cannot see the mass lesions of the lung. HRCT is used in interstitial lung disease, diffuse lung disease, bronchiectasis, emphysema. The interstitial lung disease will show a ground glass haziness pattern. The reticular nodular opacities on CT, which will have reticular opacities on CT. There will be honeycomb pattern. A tree in bud appearance, that is endobronchial tuberculosis. The crazy pavement appearance in silicosis and alveolar proteinosis. The mass lesion needs CECT with biopsy. Now comes what is HRCT. It is good for petrous temporal bone and mastoid, including a complete middle and inner ear. Now what is Gradenigo syndrome? It is a triad of autoria, abducens nerve palsy, and pain in the trigeminal nerve distribution of the clinical findings that are caused by contiguous spread of the petrous apicitis to the nearby neurovascular structures. The facial canal imaging and not the nerve. The ossicular disruption. So mostly the intracranial part of the ENT can be diagnosed by HRCT. The minute and diffuse lesions of the lung, again HRCT. It is an investigation of choice for calcification, and so the CT is the investigation of choice for calcifications. Dense things are seen extremely well on CT. Bone and blood are very clear on CT. All pneumo problems like pneumothorax, pneumoperitoneum, CT is the choice. Remember in COVID, no test, no touching of the patient, but diagnosis were being done by CT scan of the lung. The CT is a good for chest and abdomen. The electron-rich calcification is the diagnostic modality of choice is a CT scan. That is the proton-rich is MRI, but electron-rich is a CT scan. So electron-rich is CT, proton-rich is MRI. So fluid goes with MRI, bone goes with CT. So the electron-rich like calcification even do not require contrast. So what we do is non-contrast CT. Pneumothorax. The investigation of choice is CT and chest X-ray in full expiration. Now because pleural space expands with air, so pneumothorax, we require CT. And in left lateral decubitus, standing abdominal X-ray, supine abdominal X-ray, all these X-ray films are better seen, the pictures are better seen on CT. Any bleed anywhere in the body, CT is the investigation of choice and do not require the contrast. It can be done right away in the CT room. As soon as the patient comes into emergency, first the patient goes to CT because CT is done very fast. So the investigation of choice in emergency is CT. In chronic hemorrhage, MRI is the investigation of choice. Lipoma has minus 50 HU value, so will appear hypodense. Acute hematoma has HU value of plus 100, so will appear hyperdense. Air will be hypodense, hemorrhage will be hyperdense. Skull fractures are best seen on contrast CT. The fractures of C2 is best seen by odontoid or open mouth view on X-ray. So what are the other bony indications of CT? These are the fracture of the scaphoid, talus, pelvis, face, which require 3D reconstruction before surgery. The CT scan without contrast is the investigation of choice for paranasal sinuses. The chronic sinusitis CT scan is must. Surgery on face requires preface CT. Sinuses require coronal section, not the axial as in the routine. The metallic foreign body in the eye, CT scan is the choice. Wooden foreign body in the eye, MRI is the choice. A glass foreign body eye, ultrasound is the choice. Non-contrast spiral CT is the choice for all stones in kidney and urinary system. Now what is contrast CT, CECT? Vascular lesions. That is the eye, we use IV contrast, for example in pulmonary embolism. MRI can show the lesions without gadolinium. The vocal mass lesion or the nodule, CECT is the choice. Associate biopsy with CT. Example is solitary pulmonary nodule. PET scan is also a very good choice. Blunt injury abdomen always use a contrast CT. There is no risk of contrast leaking out through the bowels and causing injury because they are inert material. The suspected inflammation and infection requires CECT. Pancreatitis, colonic diverticulitis, intra-abdominal abscess. The diverticulosis, Baryon edema, diverticulitis all need CECT. There is an intraductal calculi of the pancreatic duct is best seen by ERCP, not by CT. Pancreatitis has CT severity scoring system. What is Balthazar CT scoring system? It is, the scoring system is, first one is fuzzy pancreas, second is increase in the bulk of pancreas, third is the peripancreatic inflammation and area of necrosis. Fourth is single peripancreatic collection of more or two more areas of necrosis is seen. And fifth one is two peripancreatic collections. And sixth is retroperitoneal air. So pancreatitis, go for CT scan, CECT with scoring system.